Are you ready for it? It's here, and we have a name. AAA. Ask Audra Anything. Whoop, whoop. Here we go. How do you like the name? I think it's pretty fun, but this section is just so cool and fun, and I'm so excited to be able to offer it to you. If you go back in the episodes, I think it's labeled most embarrassing health questions answered or something along those lines. I'm here for it. One of the things I get all the time from patients is that they feel comfortable asking me stuff, which I'm very honored for. And I want to bring that to you. Like, we all poop. I mean, it's just a fact of life. Why are you embarrassed by it? And we need to talk about it because it's a very good indicator of your health. But things like that. So finally, a name clicked. Thank you for the suggestions from everyone who DM'd me on Instagram at Dr. Audra Lance. I'm really excited for it. Ask Audra Anything, AAA. And this could be arranged from something you're embarrassed about or something you're just curious about, or you might be on the Google and you're finding all these conflicting answers about something and you're wanting to know my opinion. Once again, science is ever changing. If we go back even in 3 to 4 months, my opinion might change on some things because we're always trying to keep up with the research and what's going on. And that just evolves. That's life. That's science. It's pretty cool. It's pretty fun. So just that disclaimer, it's fluid. And it's what I know in this second as I'm answering these questions, but that can change. So, dun, 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 dun. First question. I had someone ask me whether they should get implants. And then I had someone asked me whether they should get theirs removed. That's a very hot topic right now, the explant world. But people are still wanting boobs. I mean, it looks good. I totally understand. We play this game where at the beach and it's like, are those real or fake when people are walking around? I mean, it's just a habit. And some of them, are real good. Some of them are like, oh, you should have probably complained a little to your doctor. I know you all feel me. So this is, once again, a tricky question to answer because it's your personal want, belief, and it also is just like, what's going on with your body? Where are you at? Have you had your hormones and blood levels checked? Are you in a healthy space where that's something you really want? Have you done all the research? Do you know what kind you're getting, what they're filled with, what the risks are? I mean, so often we all go into some of these elective procedures and we don't realize the risks or the recovery. We're fortunate enough to have a lot of plastic surgeons refer to us at the office here because scar tissue and all of the stuff after the surgery is just as important as the surgery itself. And that could be anything from reconstructive surgery to elective surgery to tummy tucks to whatever it may be. The previous episodes, I talked about scar tissue, so go back and listen to that. But it is a key factor. So I don't care whether you're getting them or getting them out. Scar tissue needs to be treated, even if your scars look beautiful. I've seen the most beautiful scars, but it's important. And we need to help drain some of that fluid and everything else going on in there, just getting you moving, making sure the tissue is moving. I will say this, anytime you make a cut, you can't take it back. As much scar tissue work as we can do for you, there's still going to be that adhesed tissue there that doesn't have as great a blood flow. When you're getting implants, explants, reduction, or whatever, I'm not saying the benefits don't weigh the costs, but you need to retrain your breathing and your stabilization. It's totally gone, thrown off once you make that cut, and your brain kind of forgets how to use it. And that isn't just doing crunches and sit-ups. That is slowing down and really retraining neurologically how you breathe, how you stabilize that pelvic floor, making sure you can breathe into your butthole, making sure you can activate that all correctly and relax it. So there's my thoughts on that. Next question. Our knee and hip shoulder replacements have come so far. And so I feel like it's become more popular for the people to go, oh man, my MRI looks like shit. I should just get a shoulder replacement. I mean, it hurts a little, but that'll be the easiest long term. Is that something you think too? And I'm like, wow. Once again, you have to analyze your whole situation. You need to know the risks, the benefits, where you're at. It's not cookie cutter. It needs to be a customized cake for you. So, as a general answer, no. I mean, you need to prevent any kind of surgery as long as possible, unless it's totally necessary and you've exhausted all non-invasive options. It's not an easy fix. I have seen, and I know so many other practitioners we talk about it, have seen so many failed surgeries. They thought that would be the fix. And you're not going to go have this knee replacement and be running in a week. There is a lot of intensive rehab and recovery, and it's almost a lifetime of keeping up with it. So why not put the effort into utilizing the joint you already have? Now, once again, I have recommended replacements. Let's get this awesome doc involved. We're going to get 3 opinions from all 3 of these surgeons that I know are phenomenal. And let's put our heads together and figure out what's best for you. But as a general rule, don't be running for the knife. I mean, there's risks. There's risks to surgery. Why have you not tried other things first? Because it seems like the easy fix when in reality it's not. So there's my 2 cents on that. Let me know what you think. Follow me, DM me on Instagram at Dr. Audra Lance. I can't wait to hear from you for the next AAA. Ask Audra Anything. Toodaloo.